Good afternoon. I'm Mike Cherry. We are on the air with breaking news. Governor Sununu and state officials updating New Hampshire's coronavirus response. Let's listen in.
I know a lot of folks like myself just finished watching the funeral services for Representative John Lewis over at Georgia. I got to say, I thought President Obama did a terrific eulogy. Regardless of party or politics, Representative Lewis was a pretty amazing individual, to be sure, on the front lines of so many pivotal points in our country's history, and clearly an inspiration for a lot of the work that we have to do going forward. So it was quite a moving ceremony. I do want to start with a brief update as it pertains to COVID before I bring Commissioner Shibinette to talk about our status of public health here. On unemployment and the status of our economy, we've got some more very good news today as it relates to our growing economy. For the first time since the COVID crisis began, we actually had twice as many people come off unemployment benefits as went on last week. That's a very, very good sign. Overall, continuing claims had the highest percentage drop in New England. New Hampshire did. Our current unemployment rate of 8.4% continues to definitely beat the averages across the country, but we still have a lot of work to do. We're definitely not raising the victory flag anytime soon, but our economy is clearly coming back. We have about 220 jobs on our unemployment security portal. 220 employers, I should say, have listed jobs available in the state on the employment security portal, and well over like 1,000, like 1,200 jobs are available right now. So there is opportunity out there for folks, for those who are looking. I guess with that, I can turn it over to Commissioner Shibinette.
Thank you and good afternoon. Today, for a public health update, we are announcing 33 new positive cases in New Hampshire for a total of 6,544. 2 new hospitalized cases for a total of 692, and 4 new deaths to report, all from long-term care facilities. In addition to those numbers, we are announcing one outbreak that is closing today, which is Birch Hill in Manchester. It's great to be announcing them. Their outbreak began on April 27th, so it's been a long run, and we're happy that they're closing today. We have no new outbreaks to announce. A couple of other quick details around turnaround times. Quest Labs, which we had reported earlier that we're having a backlog and longer turnaround times. They have started pool testing at Quest Labs, which is a great addition. It's something that our public health lab here in New Hampshire is validating right now to increase our capacity. Quest started their pool testing and expect their backlogs to be caught up by today or tomorrow, and back to their 3 to 5 day turnaround coming on the end of this week, early next week. The other thing that I want to just mention, and we'll have further details on next week, is that we are beginning to transition our asymptomatic testing locations into the hospital systems. We've been talking about this for the last couple of weeks. We are just tying up our loose ends with our contracts with our hospital partners. As you recall, we have 9 temporary sites stood up around the state. We will continue to have those sites over the next several weeks as we start to transition, so there will be duplication basically in a lot of regions. So we start the transition on August 1st. We'll probably continue with our sites through the middle to end of August the way they are currently set up. And then we'll start looking at geographic regions to make sure we have coverage everywhere. Early next week, either at Tuesday or Thursday's press conference, I hope to have a new map set up with locations. Some hospitals have several locations to be able to get tested. So we'll have a new map set up with the locations and the contact information and how to set up testing. Thank you.
Great. Thank you very much, Commissioner. One thing, before we open it up for questions, we want to talk about a lot of our funds. We come on every week and we kind of introduce new funds and new opportunities, whether they're for private businesses or hospitals or nonprofits, whatever it might be. And there's a lot of opportunity out there. And I was asked the question this morning. I was at an event in Nashua, and I was asked the question, Governor, what's open and what isn't open? And we want to just kind of give a little bit of a summary of some of the open funds that are available for, again, whether they're businesses, nonprofits, or individuals across the state. The good news is this: they can all be found in a centralized location at gopher.nh.gov. So GOFERR and we'll go over each one of these individually, but there's 6 or 7, maybe even 8 programs that are available now that people can apply into, and we just want to take a quick second and just kind of summarize them. We know we throw a lot at folks kind of time and time again, but just to be a bit of a summary here. So we have currently 8 programs available to New Hampshire residents. The first one is our Empowering Youth program. So the Empowering Youth program is run by the New Hampshire Department of Health and Human Services, designed to provide funding for summer and that bridge into fall programs for middle and high school age youth. So $2 million is being made available to New Hampshire nonprofit and for-profit summer and school year youth programs that serve middle and high school students. Applications can be found again at gopher.nh.gov/apply. So if you put the /apply in there, all these applications are in one centralized location. I saw Norm Bouthlet this morning over in Nashua. He runs the boys, does a great job running the Boys and Girls Club of Nashua, and he was telling me how they had just put in their application. So we're really hoping that these programs get going towards, as we finish out the summer, and most importantly, bridge into the school year. Applications will be taken on a rolling basis, and they close at 6 p.m. on August 17th. So still a couple more weeks for those organizations to get their applications in. Second, the New Hampshire General Assistance Preservation, what we call the GAP Fund. This is a big one for us. We have a lot of programs that are helping the self-employed or the Main Street Relief Fund, nonprofits. If any folks have fallen through the gaps, if you will, for whatever reason they didn't qualify or weren't eligible for any of those, we kind of always set up, I'm a big believer, always come prepared with a plan B, and that's what this GAP Fund is. So there's $30 million allocated. As was previously announced, the application period will close on August 4th, 2020, and a variety of different folks can apply to this. They can use a little more discretion in terms of how these funds will be distributed, primarily to businesses and nonprofits across the state. And again, it's gopher.nh.gov/apply. The third fund that we have out there right now is the Traditional Veteran Services Support Program. So the program that we announced a few weeks ago, but then put more details on earlier this week, will provide grants to eligible organizations and businesses that offer traditional services to New Hampshire veterans that have either experienced or anticipate an increased service demand as a result of COVID-19. The services could include transportation to healthcare appointments, employment supports, home services, physical therapy, a variety of different traditional programs that our veterans rely on, but have gone either have come up short for whatever reason over the past few months because of COVID-19. So it all has to be COVID related, but there's clearly a need out there, and this fund will hopefully bridge that gap for our veterans. The application period will close at 4 p.m. on August 10th. And again, those are for those, not the individuals themselves, but the organizations should be applying into that fund to make sure we are opening up those services and making those opportunities available. Another veterans program that we created was the Veteran Services Organization Support Program. So what this one is more like our VFWs, our American Legions, Disabled American Veterans chapters that have lost revenue as a result of COVID-19. So there's a slight difference. These are more of the institutions, if you will, that provide a lot of the community supports to our veterans across the state. Again, August 10th at 4 p.m. is when the application period closes at gopher.nh.gov/apply. Next, we're going to go over 3 programs that are going to launch or, in a way, relaunch today and tomorrow. So these are programs that some of which we have seen before. We're kind of doing a second and third round of funding. The first one being the Healthcare Provider Program. This is one of the very first funds we created very early on. We wanted to make sure that healthcare providers weren't shutting their doors to the citizens of New Hampshire. It was a very proud moment when the federal government took our model a little bit and created their own $100 billion fund for hospitals and healthcare providers across the country. So we're going to reopen the Emergency Healthcare System Relief Fund for a third round of funding. We've already done 2. To date, we've given out well over $50 million. This round will send out about 15 or 16 million to healthcare providers. Funding is available to all healthcare providers. This is an important one because it could be a primary care physician, dentist, behavioral health. Behavioral health organizations are out there. We want people to get those supports, get those services. It's so critical, especially in a time of the pandemic, that we've seen. We've seen a lot of people not seek out services when we know that the need is there. So we want to support those organizations so they can be reaching out to their community. The application goes live, this third round of the application goes live today, runs until August 13th, and again, gopher.nh.gov/apply. The second of these three programs is, again, a continuation of something that we created a while ago. Understanding that long-term care facilities and long-term care providers were going to be very negatively impacted, especially on the revenue side, with the COVID crisis. To date, we have given out about $11 million, and we have another $19 million remaining in the fund. So we want to really encourage some of these organizations to apply for these funds. It's available to all long-term care providers, even if you've already received money in the first round. We know that a bunch of them are still looking for additional funds. They can come back and apply for the second round. The application will, again, run until Thursday, August 13th at gopher.nh.gov. And finally, I think is this the eighth one? I think this is the eighth one. I want to make sure I got my numbers right. Nope, we got one more after this. The Safer Scholars Campus Modification Program. And what this really is, this is the $10 million that we announced a while back. It took a little while because this is a very unique program where we're really providing supports to private, nonprofit colleges and universities as they start to get ready. We know we've put a lot of money into the UNH system, the university system, the community college system, from everything from COVID supports to tuition reimbursement, scholarships, things of that nature. But this program goes specifically to the private nonprofit colleges and universities in our state. We have an amazing array of opportunities for students. This program launches tomorrow, and those organizations, again, can apply. The qualifying colleges and universities must be New Hampshire-based, first off, approved by the New Hampshire Higher Education Commission, and have a physical campus here in the state. An endowment reserves less than $300 million. We really wanted to focus on those organizations that just didn't have capital available to them. We want to make sure those doors are open as much as possible. Those COVID costs can be recovered. We heard from them all across the state, and we're able to provide this $10 million. The application goes up tomorrow and will be open for 1 week again at gopher.nh.gov/apply. But again, it's not, that one isn't so much for the individuals or the students. It's more for the institutions, similar to what we've done for the university system and the community colleges. And finally, the New Hampshire Housing Relief Program. This was launched last month. This is a great, great program. The CAP agencies, in conjunction with Health and Human Services, are really combining. We have $35 million available to individuals to pay rent, to pay utilities, to make sure that in tough economic times they can stay in their homes and have the economic support. It avoids evictions. It helps folks avoid a lot of different issues that can come up during COVID. But again, a $35 million program run through the 5 CAP agencies we have in the state. This is an ongoing program, so we're not putting an end date on this one because we know there's going to be an ongoing need throughout the fall, and folks can again apply at gopher.nh.gov/apply. And then the final thing we want to talk about today before we jump into the questions is our NASCAR race. We know that the NASCAR race is coming this weekend. It's an exciting weekend, but it obviously looks, I'd say, a little different, but really a lot different, I think, than what we're used to. Last week, I did write a letter to NASCAR President Steve Phelps, and we did inform him of modified quarantine requirements and restrictions for the race workers that are traveling into New Hampshire as part of NASCAR. They'll be here for a couple of days. But again, we wanted to make sure that they had very strict stipulations maintaining public health and safety. It does mean that staff, drivers, and other NASCAR representatives will be restricted to traveling to only the New Hampshire Motor Speedway and their hotel. They don't go out to dinner. They don't go out and get coffee, nothing like that. They're really quarantined in that bubble, if you will, between where they sleep and where they work for the day or so. Some of them might be here for a couple days, I suppose, for the 1 or 2 days that they are here, but they cannot go out in public, which again includes some of the more traditional public venues that they might visit. We also informed them that there would be a need for modifications to the opening and closing ceremonies as well, just to ensure social distancing, everyone standing 6 feet apart between the groups that are on the track. If you've watched NASCAR, as I know a lot of us do, the traditional pre-ceremony, you have a lot of people down there on the track, and we're really having them maintain that social distancing. So it'll look and feel a little bit different, but it looks like the weather should be decent and the race will go on, hopefully. We've worked with the New Hampshire Motor Speedway and NASCAR official officials just to have this assurance. Crowd size is expected to be about 12,000 people. That's about 20% capacity, so well under normal capacity for the stadium, which allows for a lot of that social distancing. We've been told by the Speedway also that nearly 90% of the expected crowd, based on the ticket sales, is from the New England area. Those coming from New England, as we have stated before, do not have to quarantine if they are going to stay overnight. It's just a one-day event, but in case they were going to stay overnight, 90% are from the New England area, where traditionally the lower COVID rates have been seen across the country. And again, I guess the last reminder is all these guidance. I mean, I don't want to go into too many details, but all of these guidance, whether it's wearing masks kind of in the general public areas of the track, the temperature screenings and the checks that'll happen as you come into the track, all done in conjunction with the Department of Public Health here at New Hampshire. Dr. Chan and Lori and their teams just did a tremendous job reviewing those guidance documents. So we feel very confident that, again, having that elevated message of wearing your mask, making sure the signage is where it needs to be. It's going to be all over the place, frankly. And just making sure that we're welcoming fans to the raceway, but also making sure that folks are staying safe. I guess with that, we can open up for questions.
Can you talk to us a little bit about Bike Week, Governor?
Sure.
Are the same protocols going to be in place for, say, the races that they're going to be held? Are you working through that? And is that through the actual venue or for the city of Laconia? How is that going to work?
So any races that are done in conjunction with Bike Week at some of the smaller tracks would follow the smaller track guidance that we've put together. The NASCAR guidance is just such a big venue. We really did a very specific guidance document for them, and we were much more restrictive because we just knew the crowds could potentially be larger. But there is guidance for those racetracks or for the restaurant venues or the retail venues. They all have guidance documents regardless of what the actual event around Bike Week might be. Again, Bike Week is a whole series of events, like sometimes all across the state. They're all connected around Bike Week, but they are all individual. They're run by individual managers. They're not all coordinated all the time. So that's why we're very specific about the guidance documents we put together over the past couple months. There's something there for everybody.
The expanded unemployment benefits lapsing, you and a lot of other folks have talked about sort of the unintended consequence of perhaps that keeping people out of participation in the economy. But it's also, a lot of people see it as a positive, that it's helped, take a lot of the bite, I guess, out of the economic impact of what's been going on over the last few months. So what do you anticipate in terms of negative impact with people losing that benefit? Are we going to start to see more privation, more of that impact, I guess, of the economic pain we're seeing?
Sure. I don't know if anyone really knows what's going to happen over the next couple of weeks with the numbers. We know there are jobs available. We have 65,000 people currently that are have current unemployment, that are receiving current unemployment benefits. We don't have 65,000 jobs available. So there is going to be a gap there. My hope is that over the next week, the Congress gets together and really finds some sort of ramp, if you will. It's probably not $600 a week. It's probably something in the middle. I think most everyone on both sides of the aisle can agree it's hard to be paying somebody more at home than they'd be paying working, right? So I think that's the balance they're really trying to find in Washington. There may be a lapse for a few days. Hopefully they get something done. But again, it'll be likely something very different. So I don't know if we know the true impacts. Unemployment benefits will be reduced if the federal government doesn't keep supporting their side of that benefit, but they still have unemployment benefits here in New Hampshire, right? We still have an unemployment program. There's money in the fund. The fund isn't going bankrupt. People aren't being kicked off the unemployment rolls, nothing like that. It's just this extra bonus that the federal government has been adding on, whether that continues or not. Either way, our economy is moving fairly well. We're on a very good track. It'll be interesting to see how whether this really incentivizes more people to spur back into work. What was interesting about this week's unemployment benefits numbers is we were down about 9%. The rest of the country was up about 3%, right? So I would have thought more people seeing that Congress wasn't acting were going to jump the gun and try everything they could to get off unemployment and really get back to their job, whatever it might be. But so we just don't know. I think what we expected to see this week, we saw a little bit in New Hampshire, but not on the national level. It'll be interesting to see what happens because it really is a national driver. But I think they'll come to some resolution. I do.
I want to ask about housing and evictions. I asked you this about a month ago. Just to start broadly, a lot of housing advocates are really worried about this week and the next week, particularly as that unemployment boost federally ends. The moratorium that was lifted at the beginning of this month included a 30-day extension. That's about to end. We're about the end of July now. And people are saying this is a confluence of factors that could lead to evictions. So is that going to be a problem in the next few weeks?
That's why I created a $35 million fund for folks to help pay their rent and pay their utilities. I mean, that's exactly what this CAP program fund is all about, and it's already, I mean, it's doing great, and I think a lot of people are trying to apply in, and that'll help. We'll also be able to gauge the need there as well, because the CAP agencies are across the state. We'll be able to gauge what the need is. If we have to put more money in, we always have the opportunity to do that, but I think we'll really see the impact of that.
But I have a follow-up question about that relief program.
Okay.
So my understanding is as of July 23rd, of that $35 million that is in that pot, only about $200,000, according to DHS, has actually been dispersed. And so advocates are looking at that and saying, yes, there is a $35 million program, but it's taking so long to get this money to people that they may be evicted before they even get this money. What are you doing to kind of address this and to try to make sure?
Are
that
you
people
hearing the same stories that people are applying and not getting funds?
No,
because
but
that's a different
The
right.
process. What I'm hearing is that the process is slow, owing to the fact that the CAP agencies do not have the staffing in order to take in the large volume of requests of the last few weeks, and the fact that there's a lot of paperwork requirements for tenants to prove that they do need this assistance. So the worry is that as this eviction kind of potential comes up in the next few weeks, the money's not coming out from the state, and there are tenants who are going to.
Again, we maintain a great relationship with all the CAP agencies, and we'll work with them very directly, one-on-one. And we're happy to address those issues if they come up. I mean, no one's brought it to our office, but I'm always for streamlining a process on applications. I'm always this money is not designed to be held by the state. We got to get it out, to be sure. So we're happy to look into that. But I have a lot of confidence. The CAP agencies have run very, very well, and if there are issues, they'll bring it up to our level, and we can address them.
To be clear, that in a reissuance of the moratorium that you had issued earlier, is that completely off the table at this point?
Nothing we're considering right now. No.
Okay.
No. I got to tell you, the one area where we're concerned about evictions, it's on the residential side, sure, but also commercial evictions. That's coming up because the landlords that have commercial properties as well, in terms of overall economic impact, that's a big one as well that we're looking at. I think the hope was that the Main Street Relief Fund, putting out $350 million so people could pay their utilities and rent, would cover a lot of that. Some landlords are working with their tenants, some aren't, on both the residential and the commercial side. So there's kind of both sides of that coin. But that's what we do all day. We'll keep watching it day in and day out.
Governor, I know you tweeted about this today. The president has suggested the idea of delaying the election over voter fraud concerns. Your reaction to that? Will it happen on time here in New Hampshire?
Well, like I said, make no mistake. Our election is going to happen on November 3rd. End of story. Our voting system has integrity. It's reliable. It's safe. It's secure. We've done it right for 100 years. And so, our elections are definitely happening on November 3rd. I can't comment as to the nature or the whys of his tweet, but.
Do you have any reaction to the ruling by Judge LaPlante about libertarian ballot access? This was something.
No, again, we didn't get involved in that whole issue because there's an inherent conflict of interest because I'm on the ballot, right? So we said, no, go take it to the court, let the judges decide exactly what you want to do, and that's it.
On the NASCAR front, in addition, is there anything in addition, precautions, and excuse me if you've answered this already, but on the NASCAR front, are they testing the pit crews and ancillary people that you mentioned that are going to be subject to either staying at the track or at their hotels? I mean, do we know
No, I think I can't speak to the testing protocols of NASCAR other than to say probably only if they're symptomatic, but I don't know. You'd have to ask NASCAR if they have additional testing protocols that they implement.
Is there or should there be a duty to report employees at a business which have COVID-19? Carol Robideau at Manchester Inklink had an interesting story today about a country club in Manchester that closed due to a worker testing positive. Yet there was no public notification of that information.
Nor should there be.
There shouldn't. Why not?
Let me take you back to 1988. What if you had asked that question and said, should we start exposing everyone who has AIDS? I mean, you were talking about private information of an individual. For the government just to come out and say, we're going to put up a blacklist of everybody who has COVID-19, no.
That couldn't necessarily be traced. They have maybe 10 and 20 employees. How would you know which employees?
Well, you're saying expose their names?
No, just
what was
that it was closed.
Sorry.
Josh, again.
Well, the business, not the individual.
Yeah.
Oh, if the business were to close?
No, disclose the businesses where.
Where people have COVID?
Where a closure
Oh.
is prompted by COVID.
Again, you're walking a really dangerous line. We have a lot of small businesses here. It's going to be real easy to determine who has COVID and who doesn't if a business were to close. Fred's Flower Shop has 4 people in it. A business closes. No, you're really walking a very
You draw
dangerous
comparison
line.
to AIDS, I mean, the transmission of AIDS.
No, I
is
thought you were talking about
obviously more
individuals,
fraught.
putting out individuals'
A bit
names.
more fraught than,
Yeah.
like, transmitting COVID is obviously
Yeah.
a less intimate
No, but
thing.
But again, it's private health information, healthcare information that you can't be putting out on individuals by any means. And it's not just names. There is indirect exposure that you can give. You can actually identify someone indirectly by giving their business or giving their neighborhood. Or even in a small town, if you remember, we weren't even giving exact numbers in small towns because it was going to be so easy to kind of figure out who had COVID. So you got to really walk a very careful line there. The federal government's very, very clear about that.
The governor, doesn't DHHS put out, norovirus outbreaks? Their business is identified in those circumstances.
Yeah.
Yeah.
I'll turn it over to the commissioner. Yeah, sure.
So in the case, and I'll use your example, Manchester Country Club, I think that's who you said. The reason why we don't announce is because we've done contact tracing, and our investigation has revealed that there was no or minimal exposure to the public. And that's how we make the decision on whether to announce or not. So the person at that country club could have been someone that washes pots in the kitchen that never had interaction with the public. And when we did our contact investigation, they said, oh, my only close contacts was this person and this person, so we quarantined them, and there's no exposure to the public. As in other cases, when we had something at the DMV back early on, we did put out public messaging, and because our contact tracing investigation said we can't be sure that there wasn't a close contact with a member of the public. So when that happens, we do put out public notification. So it really is based on what comes out of our contact investigation.
But other than the DMV, I mean, have there been any public notifications of anything other than outbreaks at nursing homes and long-term care settings?
So my answer to that, no, because our contact investigation did not reveal that there was an exposure to the public outside of just general community transmission. So we need to remember that COVID right now, we've said over and over, is widely being transmitted for community transmission. So you're at a general risk of getting COVID just being out in the community, at the grocery store, at a restaurant, anywhere that you're in an indoor space, you have a risk of getting COVID. If we believe, because of a positive case in any business at all, from a local restaurant to a country club, that the public is at a higher risk of contracting COVID because there was a positive case that had close contact, we will put out a public notification. So if we haven't done that, it's because, no, it did not, it hasn't happened.
So on the public outbreak front, I mean, it's good news that Birch Hill is off. How many outbreaks are still active?
3.
3, and is the Greenbrier among them in Nashua?
Just check my list. Yes.
Okay, because they've obviously had a lengthy problem, I believe, since May. They've had outbreaks, and they've had a pretty lengthy record of deficiencies, both state and federally cited. So I guess my question is, are there specific policies that the state is imposed or seeking to address the problems at that facility due to their track record?
Any type of corrective action would be in their plan of correction. If you're citing a state or federal survey that you found on a website, then their plan of correction would be there, or you could request a copy of their plan of correction if it's been submitted. Facilities that are larger have longer outbreaks. If you look historically at the buildings that we've had that are 200 and 300 residents, they tend to have longer outbreaks because there is more people to transmit to. They have more staff, they have more residents. Our facilities that have 20 and 30 residents in their building tend to have shorter outbreaks. It makes sense because there's less people to transmit the virus to. We work with every single facility that has an outbreak. Every single nursing home has had a survey, whether they've had a COVID outbreak or not. We do infection control assessments with them every time that they have an outbreak. I can't tell you that we have an entire unit at Public Health dedicated to just nursing home outbreaks or institutional outbreaks. That's all they do day in and day out, 12 hours a day, is talk to nursing homes that have positive COVID people. So I think we've got guidance covered for sure. If they have found deficiencies in nursing homes, we have a system that is set up to take care of those. You know, if for some reason Health and Human Services has issued a citation or a deficiency, there is a process where they submit a plan of correction. We go back, we make sure they followed their plan of correction, and everything is in good order. We're following the same system that's been in place since probably the 1980s when it comes to plans of correction. If they're not correcting the action, you would see more steps from the state and from the federal partners if they're not correcting the deficiencies we find.
I want to ask about NASCAR generally, this race coming up. Is it fair to say, and this is also for the governor,
Oh, good.
for both of you, is it fair to say that this is the largest event since the outbreak, since the beginning of COVID-19 in either New Hampshire or northern New England? You mentioned 20,000 people potentially.
12,000, but yeah, I would imagine so.
Okay.
Yeah, I mean, I off the top of my head, I can't think of a larger event.
Yeah, so can you just, again, we're kind of days away, what are the conditions that you think make it appropriate to hold the largest event yet, when just a few months ago we had a ban on 10 people or more?
Yeah, so it's not just the size of the event, it's the ability, it's such a large venue. So you can bring 12,000 people in, and that's still only 20% of capacity. It's just a fraction of the capacity, which means there's a lot of the social distancing, which is very important. The mandate of masks, you know, when you're up and walking around, I think when you're sitting, you don't have to wear your mask, but if you're up walking around getting food, you got to have your mask on. You're going to the restroom, you got to have your mask on. Everyone gets temperature checked and screened and goes through the screening process when they come in. We have these whole new set of protocols just for the staff that is running the event that we've created for them, so they kind of sit in their own little quarantine bubble. They don't mix and mingle with the public. The vast majority of individuals that are coming to the race are from the lowest area of COVID. About 90% or so, 85, 90% are from New England, and New England is right now one of the lower areas, so there's very few people, if any, coming from outside of New England or areas of high incidence. And just, I mean, there's like 40 pages of NASCAR guidance that have gone into this, all the kind of the backroom type stuff that typically would happen with congregation and the team meetings and all of that. That's all gone. There's no RVs. There's no multi-day event. They've really skimmed this thing back, way back. It's people showing up for one day, taking all the right protocols, watching the event, and going home. And so there's no camping this year. No.
But are you worried? I mean, obviously, there's
Well,
sort
we'll
of
watch
fingers
it.
crossed
No,
kind of
well,
thing, or-
I got to say, I think, again, public health and ourselves and NASCAR and everybody really came and I think found what we believe is a safe solution. No, I'm not worried, but it'll be interesting to see kind of what happens and less about, I mean, we'll watch the numbers if there were an outbreak, of course. We know we have the best contact tracers in the country. We're going to know pretty quickly. But one thing I'm interested is the response of the fans. You know, what is their response? Are they comfortable with that? Like, what's the attitude there? Are people really following those guidance and rules? And they're going to have a monstrous staff there just really making sure that they're buttoning down. You know, similar to, it's not Canopy Lake Park, but it's similar, right? It's a large gathering. I got to say, from what I've seen already, I don't mean to divert topics, but it's similar. Canopy Lake Park, a tremendous job. I mean, every staffer is right on folks to keep their masks up, to maintain 6 feet. I mean, they are really good about it because they know how important it is. Nobody wants to have an event and have an outbreak. That would be potentially devastating for them. So they are going, excuse the pun, the extra mile, right, to make sure they get it right, and I commend them for that. So I'm given all that they've put into this, I think it's the right approach, and we're confident it can go off safely.
Governor, it won't be too long until people have to start thinking about home heating. Any of the CARES Act funds, is there any plan to perhaps set aside some of those to assist beyond what comes in from LIHEAP?
Sure. So LIHEAP, the CAP agencies, this fund would go for utilities. That would count as a utility. If we have to put more stuff in terms of home heating or LIHEAP, I mean, LIHEAP's a great program, by the way. I think it was underutilized last year. It's run by the Office of Strategic Initiatives, and we're happy to put more dollars in there as well. I mean, utilities, paying rent, basic necessities, that's exactly what what we really need to be going for here. And that's, I think we've done a very good job of keeping our focus there. But you bring up a good point. This fall, there'll be new needs that kind of start arising. We have about $250 million that we have left unallocated so far. So we have some room, knowing that we could have a surge in the fall. You know,
So the Utilities Assistance Fund then that's something that could
potentially help
from
with.
CARES,
Yep.
So it's already dedicated, I guess.
Yeah, it already is, but you're right. We could go through the LIHEAP program, which kind of starts up in the fall, if you will, or you could potentially just go through the CAP agencies, or a little of both, right? You just want to make sure it's available as easy as possible. LIHEAP program is very, very good, but not everyone has ever used it before. One thing that whether it's unemployment, LIHEAP, some of these assistance funds, families are relying on them when they've never had to apply in, so that's why we're trying to make it as easy as possible. So we want to make sure there's as many doors as possible as well. We'll do a few on the phone.
The next question comes from Holly Raymer with Associated Press. Holly, please go ahead.
Hi, I have one question for Commissioner Chevanette and then a question for the governor. On today's call with the reopening task force, Trish Tilley was talking about how public health has been working very closely with the overnight summer camp. And she said at least one of them has had great success following the guidelines where they have had no positive cases. So my question is, does that mean that there are others that have not been successful following the guidelines and that they've had cases?
Was that for
that's my next one now.
Was that for the commissioner or for me?
Yes, that was for the commissioner.
Oh, okay. Yeah, do you know, I'm not sure, I hadn't heard of anything.
Thanks for the question. I'm not aware of any outbreaks at any of the overnight camps. Doesn't mean that there hasn't been, an isolated positive or something like that. We give guidance to people on a regular basis. We have members of our public and our families that could call and say, I saw someone not following the guidance, and we call and we correct that. So those things may have happened, but I am not personally aware of anything like that going on.
Thank you. And then my question for the governor, just to follow up on the earlier question regarding your reaction to the president's tweet about delaying the election. Does the fact that he even suggested that affect your support for him at all?
No. Look, the president says things and tweets things all the time that, we just call the balls and strikes like we see them. I don't know why he tweeted that out. I don't know what his thought process is there. I can only speak for New Hampshire. We have a great system. It's a great system, so that's it.
The next question comes from Rick Green with the Laconia Daily Sun. Rick, please go ahead.
Hi. You mentioned, Governor, last week that you'd have some news on the emergency broadband expansion program, which earlier, the mid-July was set as the time frame for awarding contracts. Have any contracts been awarded? And has that program been a disappointment?
No, it's definitely not a disappointment. I know I was hoping to have an announcement today. We're pushing it one more week. They're finalizing the contracts with a few last cities and towns. So a lot of the contracts are there. I think they want to release all the contracts kind of in a batch this week, where there's still plenty of time to get those projects done. That's the good news. But I literally got off the phone with some of those folks this afternoon, and they're literally just making sure they're dotting the I's and crossing the T's on. They're very complex projects, frankly, just when you look at all the different landowners and hookups and all of this sort of thing. But we'll have a robust presentation on the projects, on the contracts, on everything, probably Thursday of next week. At least that's the deadline I gave them. So I'm going to be here talking about it. So I hope they have, one way or the other, we'll do a little map and a bit of a presentation. But no, it's not a disappointment at all. Again, we tried something no other state even tried. Right? Very few states could even try doing the broadband program because it's such a short time frame. So we just pushed really hard. We tried to go as fast as we possibly could, and we're going to get some good projects out of it, to be sure. Great. Yeah, sure.
One other follow-up here, let me see this. Following up on what Josh had asked about some of the business contacts, would it be helpful to update any of the guidance to assist in easing contact tracing if businesses were able to had to gather a little bit more information, a phone number or something like that from people to make sure that they could contact them more easily had they been to that business? Because obviously you're not going to know who comes and goes all the time. And what else has to go on once one of these outbreaks happens in terms of cleaning? Are there any mandates from the DHHS side before these businesses might reopen?
Yeah, I'm gonna have Commissioner Shibinette answer that.
Thank you. We do have guidance on cleaning and sanitation, and we are normally contacted through public health, and we give direct guidance in case, every workplace is a little different. As for collecting information, when you look at a close contact, it is not someone that you pass in a hallway. It's not someone that you stand next to, for 30 seconds or a minute, or it's not even someone that hands you your drink at a Dunkin' Donut drive-through, right? So a lot of people confuse those two things. So a close contact, typically, you're looking at about a 10-minute time frame. A lot of the businesses that have customers that they're with for 10, 15, 30, 60 minutes, they have that contact information. I think it would be pretty disruptive to, let's say, a Dunkin' Donuts, that if everybody that came through the drive-through, you said you're going to have to give me your name and your phone number. So, it may make some things easier, but I think how much it would disrupt the business would be problematic. We haven't. Based on the fact that we haven't had to do a lot of notifications, public notifications about businesses, I would say that our contact tracing investigation leads us down the right road.
Question on ventilation generally, I guess, for the governor. And I'm sorry I wasn't here on Tuesday if you were into this already. So obviously you're undergoing a review of nursing homes right now and looking at particularly the ventilation systems. Yes. This is something that school administrators have brought up as well as a big problem. What is the state's plan for all these facilities like nursing homes and schools that are deficient with their ventilation systems? Is there a plan right now? Is there something in the works in terms of being able to help them fund this?
So we announced last week that we are starting a program, or I should say this week, I guess, that we're starting a program. We started on Monday, where we're looking specifically in the areas that had long-term care facilities, that had outbreaks. We're going to go in and look at those ventilation systems. We're just trying to get ahead of the game. We're just trying to see, again, those folks have, when they were going through their outbreaks, obviously we couldn't send a team in. They were dealing with health care of the individual, as they should. But now we can kind of go back and look at everything from how the air was moving, patient-to-patient contact, patient-to-staff contact, asymptomatic contact, how the air flows room to room, right? Is it an older system? Do they need to change their filters? So knowing that, we'll wait to see kind of what the data brings, but we are already putting on the table potentials, right? Is there the potential to upgrade the system, clean the filters, if we find that there is a direct link? We don't know for sure if there's a link. There's been discussion that this could be airborne. This is not an airborne virus right now. It travels with water particulates. They typically don't travel too far. We've discussed that quite a bit. They tend to fall to the floor or glom onto something. But if it were truly airborne, it's a whole different ballgame. So we just want to see how that air is being ventilated. Is there a connection? Is there a correlation? And then from that data, we can extrapolate to either take it to another phase and look at other institutions, look at schools, look at anything like that. But we got to kind of have the data first and then figure out, okay, if we're going to do something, is it CARES Act funds? Is it stimulus funds? Is it upgrades of the system? I don't think it's realistic to say we're going to go in and tear out every ventilation system of every long-term care facility across the state. But there's probably some upgrades or some assistance that we could provide based on what we learn.
Where do you think the bulk of that cost of repair is going to fall to? Is it going to fall to localities like counties for nursing homes or districts for schools, or is it going to be largely state money or largely federal money?
As much as the state can carry, we want to carry, because my sense is this would be a statewide problem. It's a COVID problem. I don't think any facility would be immune to it. I mean, maybe a newer facility or something has some of the more high-tech equipment in there, or sanitization of air equipment or something like that, some of the UV equipment. But we, especially around the older facilities, if we have to help make upgrades, we're happy to do that. We're not making any financial commitments, nothing like that yet. We just don't know what the data will show us. And if the data comes back and says, look, the places that clean out their air filters, they were in good shape. But the ones that don't, well, that's an easy problem to fix, right? If they come back and say, boy, any place that is transmitting air from room to room, those are much, much bigger and long-term problems, but
Sorry,
we have to
I don't
address.
think you addressed schools.
Oh.
Did you?
Schools would be in the same boat. I mean, I think what we learn from a long-term care facility, we'll try to extrapolate to other facilities that have similar type systems. Remember, schools are so different now. I mean, Dover High School is a very modern high school with, lots of air exchangers and vents. Some schools in our state have nothing. They have windows. They literally are opening the windows, which isn't the worst thing in the world in the COVID epidemic. You want actually, fresh air flowing through. Some are just have air systems, but they're antiquated, right? They're not getting the job done. They're moving air very slowly, or they're not filtering and cleaning it the way they should. So I think you're going to see a spectrum of issues that are the long-term care facilities, and then we can translate that into the opportunities to create for schools or whatever it might be.
Plan for funding for those upgrades in schools in the next 4 weeks before they open.
I don't know. I mean, I think if we can get some data in the next couple of weeks, we'll move as fast as we can. So I don't want to say no. I mean, that would be hard to do anything in the next couple of weeks as we just started this whole project. But if we can extrapolate something out and move quickly on some areas of need, I don't want to say no, but that might be a challenge. But even if a school is already open, doesn't mean you don't help them out. So that's a possibility too. We just don't know what the day is going to tell us. But I don't know of any other state that's doing this. I've talked to other governors. No one else has really said they're looking at this. So, I talk to other governors a lot, and I try to get data and what they're doing and what we're doing. So we'll share the information nationally as well, just in case we find anything out. It's a bit of a research project, but I think with real positive end goals in mind, and where we can turn it into something tangible for these facilities.
Governor, when it comes to the self-attest for the 14-day quarantine, I know you said before you're not a big fan of models, but you have to account for some people not being truthful about that.
Sure.
Do you have an estimate? When you went into this, did you figure this number of people are going to lie to us about this?
No, that's an interesting question. How many people did we estimate would lie about the self-attestation? It's a good question. I'm not, but no, I didn't make an estimate on it. I don't know. We have a very tough thing to estimate. How untruthful is America, right? On social media, it's one thing. Face to face, it's another. I don't know. No, we assume that everyone is telling the truth. We assume that they are. And again, because we have such good contact tracing, and when you go into a hotel, we know where you sign in. So that's one area where you do have to give your name and phone number. If there were outbreaks there or anything like that, we'd know it pretty easily. And we haven't found any super spreader events or anything like that. So I think for the most part, people are being safe and cautious.
Are the hotels that these NASCAR people are they having blocks of rooms that are separated from the public? Is there any?
They're all different.
Yeah.
Yeah. NASCAR runs. The teams are independent, so I believe my sense is they make their reservations on their own. But they all know what the rules are. The hotel, they have a copy of the letter that says what the rules are for the hotels. There is enforcement tied to this. So if they break the rules, the teams are fined. There's a whole penalty enforcement piece that's added to this. So which they take very seriously in NASCAR. So no, we made sure that we buttoned it up pretty tight.
What are we talking about for fines?
It's a NASCAR. That's a NASCAR fine.
It's gonna be.
Oh no, NASCAR fines pretty heavily is my sense, but I don't know.
But just to be clear, there's no, the 14-day self-quarantine attestation process is waived for these folks.
Yes, because we're in a way waiving the 14-day attestation because they have to live in this under these different confines. So it's a different style of quarantine, if you will. They're quarantined to their job essentially for the 1 or 2 days. Most of them will be here for 1 day. There could be a couple here for 2 or 3 days. So it isn't a long-term event. That's the good news. And I think NASCAR takes their enforcement policies very seriously.
Do
So
they mostly fly in, and do they fly into Laconia or Manchester, or do they drive?
I don't know. I mean, I see a lot of, look, every year I see the big trucks, the big NASCAR trucks coming up. So there's obviously a lot of equipment to be driven in. I couldn't tell you if the individuals are driving or flying. I'm not sure. Okay. Well, thank you guys very much. Hope everyone has a great weekend. We'll be back on Tuesday. Thank you.
And you have been watching Governor Sununu discuss the COVID-19 situation here in New Hampshire. Let's take a look at the latest numbers. State health officials announcing 33 new test results today for a total of 6,544 cases, 2 new hospitalizations, as well as 4 deaths, all linked to long-term care facilities, bringing the state's death toll from COVID-19 to 415. State health officials also announcing a COVID outbreak that began on April 27th at Birch Hill in Manchester is now closed, and there are no new long-term care facility outbreaks today. Quest Labs is now conducting pool testing, which is expected to speed up testing time. The lab expects to be caught up on testing backlogs by today or tomorrow. and be back on a 3 to 5 day turnaround schedule by next week. The governor also announcing details of 8 New Hampshire-based relief programs. Applications for the GAP Fund are due August 4th. Applications for the traditional Veteran Service Support Program and Veteran Service Organization Support Program are due August 10th. Healthcare provider program applications and long-term care provider program applications both due August 13th. Now, those are open to all healthcare and long-term care providers in the state. And applications for the Empowering Youth Fund are due August 17th. Lastly, applications for the Safe Scholars Campus Modification Program open tomorrow for 1 week. That is for private nonprofit colleges and universities. And the New Hampshire Housing Relief Program applications are open until further notice. Individual Granite Staters or Granite State businesses that meet the criteria for any of those 8 programs can apply at gopher.nh.gov/apply. The governor also announcing new guidelines for Sunday's NASCAR race at New Hampshire Motor Speedway. Staff, drivers, and other personnel are only allowed to travel between their hotel and the Speedway. They're not to go out to New Hampshire stores or restaurants while here for the weekend. NASCAR says 12,000 people are expected to attend. That's about 20% capacity for the Speedway. And 90% of spectators are coming from a New England state. A reminder for anyone headed to Loudon, Sunday's race is for the day only. There will be no overnight camping allowed. Thank you so much for watching this breaking news update. We'll have much more on today's announcements beginning tonight at 5 on WMUR.